My grandmother was a participant at WelbeHealth from 2021 until she passed away in 2023 at the age of 88.
My grandmother was the kindest, most generous, most selfless person that I know. She grew up in China and was widowed at a very young age, and so she was a single mom with young kids. She came to America in the mid-'80s. There was never a doubt in her mind that she was in America so that she could continue to provide for her children.
She was probably the most consistent presence in my life growing up. She kind of showed us how to live life, really. She was always just kind of like a beacon of happiness.
I think for Chinese cultures, we're taught to respect our elders. We're taught to care for them. As we realize that the rules are starting to reverse, we wanted to give my grandmother the independence and the dignity that she wanted and deserved. And we wanted to make sure that she was as happy and healthy and vibrant as she possibly could.
She had an issue that required her to be hospitalized. It was decided by her primary care physician that she may not be able to kind of support herself and live on her own. And so they had discharged her to a skilled nursing facility. It wasn't what she had wanted. She would say, I want to go home. I want to go back to my home.
Our number one goal was to get my grandmother back home. But we as grandkids and kids, we couldn't provide that level of support on an ongoing basis. We already saw her decline mentally because she didn't speak English. We were taking her away from her entire community, and she wanted to get home, but she would never have fought for it because she didn't want to be a burden. So instead, we fought for her.
Luckily, my sister has a friend whose grandmother was part of WelbeHealth, and we thought that maybe this is probably a good place to start.
I knew that my grandmother would have likely been eligible given that she was a Medicare Medi-Cal participant. What I didn't know is all the wraparound care that WelbeHealth could provide. In learning more about WelbeHealth and the home health aides and the social workers and the case managers and dietitians and nutritionists, I think it was a no-brainer at that point. For my grandmother, it was a difficult adjustment because her, old Chinese women, change is very difficult. And she had been going to her PCP for decades at that point. I think for a lot of Chinese families, especially immigrant families, there is a lot of trust in the healthcare system, period. You'll very rarely see anybody challenging what their physician is recommending. It is still also a cultural barrier where we're not necessarily knowledgeable of all the options out there. But when we said to her that it was going to be better for your own health and you were also going to be able to get back home, I think that was the deciding factor for her.
Having WelbeHealth as part of our lives, as part of her life, almost immediately it seemed like her mental state had changed. She was talking, she was laughing, she was night and day. It was almost like turning back the clock a couple of years.
We got 2 great years with my grandmother because of WelbeHealth, and she was at home, she was happy, she was able to play cards and play mahjong. And I think sharing this story, if I can help somebody else in my shoes, I think it would be worth it. Most families like mine have elderly family members who can't speak English. So why would you put them in that situation where they can't communicate and they're losing their dignity and they're losing their freedom and independence? When WelbeHealth is such an easy alternative where they can stay at home, you can get the support that you need to be able to help them live the rest of their lives with as much freedom as they can.